with the higher potency, we are seeing true withdrawal symptoms. We're seeing true cravings.
For me, it's newer to see this happening, but I see it happen, and it's happening a lot.
Hey everybody, welcome back to the channel. This is Dr. B Addiction Recovery. And the topic I want to distill today is, what is cannabis-induced psychosis? Today's a little different. We're going to be on two channels, and I have a co-host, Pej, which many of you know already. Pej?
Hi, my name is Pej. I'm an interventionist. I help people with addiction problems, with alcoholism and mental health. I'm very excited to be here today talking with you, especially about this subject, because I'm seeing a lot of this happening to lots of people. People are getting psychosis as a result of THC. Who would have thought?
Interesting, right?
Right?
Yeah. Where are you seeing it, and what age group are you seeing it in?
Well,
I'll give some feedback, but I'm just curious what your experience is, since you've had some experience with it.
Mainly with a lot of adolescents, people between the ages of 12 to 14 to about 18, 19 years old. I believe that they are getting various cannabis-related products, a lot of THC carts, wax pens, weed pens, things like that, straight concentrate, and then some of it could probably be counterfeit. It might be tampered with because they're buying it from various sources. So it's definitely taking their mind. And I know a lot of people will get high and be fine, or think that they're fine, but there's some people who it's affecting differently, negatively.
And we'll get into what is cannabis-induced psychosis, but I'm more interested. A couple of things you mentioned, kids, adolescents, and we're in California. So you were seeing that locally in California?
I'm seeing it on a national level, even on a worldwide level, because, when you're an adolescent, a lot of kids they think because their friends are doing it, that it's okay for them to do it. And so, in California, definitely. I mean, there's a lot of cannabis out here. But on a national level, I'm hearing a lot of people are encountering.
Here's an interesting case for you. Do you know what the youngest kid that presented to the ED with cannabis-induced psychosis was? Imagine what the age is. Do you know about this?
I don't know, but
7.
That's young.
Right.
Yeah.
And so we can get a little bit into that until we have time. But yes, you are absolutely right. In fact, the data on especially places where you're tracking this stuff. Well, we're tracking it everywhere, but a lot of data is coming out of Colorado, mainly because it's been legalized. And the question becomes, what is the impact of that? What is the risks, benefits, costs to society, so forth? Because of that, there's a little bit of a microscope on that issue, and the experience of the frontline emergency department guys is, they're getting 2 or 3 of these cases a day, and they are minors, younger and younger and younger. And that could be happening for various reasons, which I can't get into here because we want to keep this short. But I certainly want to discuss and kind of do a brief deep dive into what is cannabis-induced psychosis, and maybe a little bit into what you actually mentioned before we started, the potency of this stuff.
Right.
Let's just say, as far as cannabis-induced psychosis, and I will just say psychosis is psychosis.
Right.
Whether it's methamphetamine-induced, cannabis-induced,
hallucinogen,
schizophrenia, or some of the diseases, right? And psychosis has a clinical definition, right? You have to have delusions, fixed false beliefs, right? I might believe the CIA is coming out to get me, and there's no evidence of that. You have to have hallucinations, which these are your sensory perceptions of the world, whether it's auditory, visual, somatic, and so forth. And then, they add modifiers to these for persecutory delusions. Okay, that guy's out to get me, and he's just out there mowing his lawn. Yeah, it doesn't matter, but you see different ones, a little bit with different diseases usually, but psychosis is also disorganized thinking, disorganized motor behavior, disorganized speech. There might be some cognitive issues, and there's also negative affects of this stuff. Usually with the drug-induced psychosis, you don't see that. So it's not a disease by itself, but it's a presentation of a spectrum of schizophrenia, and the poster child of it is schizophrenia.
Right.
And then we can go into substance abuse induced. And in that sense, folks are presenting, like you said, to an ER with initial presentations of psychosis from this stuff. So I think the next question for us is, well, is this a new thing or has it always been the case with marijuana? You tell me. We're both around the same age, but, 30, 40 years ago, did you hear at school, we were all at school, this kid went nuts doing acid. And, you do have a history of being in that environment. When you were younger, did you see cannabis-induced psychosis?
I can't remember if I actually, there was probably in our circle of friends that were using or experimenting, there was always that one guy that when he would use cannabis, it would affect them differently than it would affect some of us. And I mean in the sense that they would become highly paranoid. They would...
well, that's psychosis.
It is. Right? It's total psychosis.
Yeah, it's a false fixed belief, probably.
Right. They couldn't handle loss of control. And down the line, they became the person that would possibly drink or do other types of substances. But when it came to that particular feeling, they didn't want to endure that anymore, so they wouldn't do it. They stayed away from the marijuana. However, back then we also we were smoking what they call it flower now.
Flower. It's weird.
We call it bud, right?
Yeah.
And so there was different potencies for the different types of marijuana that we would get. There was the very strong stuff. There was the outdoor stuff. There was the stuff that was grown in certain type. Just like a horticulturally grown in certain types of indoor settings. So it was a lot more stronger, but I personally don't ever recall encountering psychosis. What some of the kids that talk to me these days describe as what's now called depersonalization or derealization, I ask them, so what is it that you're feeling? And the description of how they're feeling, like they're kind of, it's an out-of-body experience, and it lasts. Like they'll stop even doing the cannabis, but because they want to see, am I going to be like this forever? It seems like it's uncomfortable in a sense. And I don't know that it's total psychosis yet, but because they're still somewhat normal now, but they're wondering, how am I going to get this feeling of, they're in full flight from reality, basically. How am I going to get this to stop? And will it stop? What do you recommend I do? And I often will tell them, maybe you should need to see a doctor, first of all, just to see if there's something that they can do to help you stabilize.
So I love that. And, it is frightening and really jolts a person in that state, especially a young mind who hasn't had that many experiences in that way. And, these things can really leave a lasting effect.
Sure.
But I think we can both say that, in the 90s, flower, bud, whatever, you would hear somebody of, having an episode of really severe discomfort. It may have been psychosis or not.
Yeah.
But it certainly wasn't ubiquitous and prevalent in the way that it is now. I think we can say that. And I'm pretty sure the literature supports it. Now, that could be maybe a lot more people are smoking pot.
Yeah.
But I don't think so. And I do know this. If you recall in the 90s, it was always pointed out the bud, the flower, whatever, the pot now is 100 times stronger than the stuff they used to use in the 60s.
Sure.
This stuff is potent.
Yeah, this is the good stuff.
Right?
Yeah, that's the way
now, the potency is through the roof.
Through the roof. And they're also, the way it's being distributed too, like when you have canister, there's no leaf or anything like that. It's straight concentrate. Like they have absorbed the most powerful forms of it. The THC is basically high percentage. Of course it's going to get you super high. To the point where you're somewhat, maybe even mildly hallucinating, if not really hallucinating.
Absolutely. So one thing that we can say, I think we can say the potency is much higher, but along with the fact that we're seeing this episodes of psychosis or mental health issues that they present to the ER, in addition to that, some of them are presenting with severe anxiety, severe panic attack.
Sure.
And I think some of it is that depersonalization, derealization. Again, there's a lot of data, but we're also, alongside with that, we're seeing a lot more what we used to kind of blow off as, that's the system, the establishment. You can't get addicted to this stuff. With the higher potency, we are seeing true withdrawal symptoms. We're seeing true cravings. And I don't think we necessarily saw that so often before.
Yeah, didn't see it that much.
So we've established two things. We think the potency, but we know the potency is higher. This is inducing psychosis much more frequently. We're seeing it in a lot younger folks. And again, each one of these, we could do a deep dive in, and there's a lot of literature and data that kind of explains those, but we want to establish some things. So, it is truly causing psychosis. They're presenting to the ER, much more of them. The weed is much more potent. We've also established that we can certainly say now people are going into treatment for
primary
withdrawal craving.
Yeah.
In fact, I have a patient right now that every time he comes in, his whole thing, he's like counting days. He's 150 days that he has smoked his last pot.
Yeah.
And it's a great victory to him. And I applaud him, and I'm happy about it.
I like that.
So we do know those things. So we're right. And they are presenting younger and younger, and it's maybe more accessible. They're getting parent stuff at home. And again, it becomes like alcohol. Think about it. If you're saying something's not a drug or a poison, which alcohol is a dose-dependent poison, period, end of story.
Yeah, totally.
Kids are going to have access to it. I want to point that or bring something else up. How do you know once a person goes to a provider and so forth? How do you differentiate meth-induced psychosis, cannabis-induced psychosis, bipolar disease, schizophrenia? I think that's an important question, especially for family, parents, and loved ones out there. And even for some of the folks out there that might have experienced this or may be having issues at this time.
Mm-hmm.
And if it's okay, I want to address that. And I might facilitate even you being out there when you're doing your interventional work.
Yeah.
And I think the answer is very simple. It has to be done with a professional provider. Right?
Absolutely.
That looks at that.
Yeah.
And it's all about what we call the history of the case, right?
Mm-hmm.
There's got to be the physical exam. Okay, this is a psychotic episode.
Sure.
It hasn't been there before. And that history is teased out by looking at family history, history of schizophrenia, history of history of schizophrenia or psychotic disorders, bipolar schizophrenia.
Yeah.
Is it in the family? What is the age of onset, right? Sometimes you do have to, in this case, do a drug urine because you want to see what's in there. Is there other drugs in there like methamphetamines that have causes?
Yes. Mm-hmm.
What is the person's personal history over the last few years? Have there ever been psychotic breaks? Again, what is the age?
Mm-hmm.
Is he 50 years old and having a first psychotic break? It's usually not a primary axis one, bipolar or schizophrenia. And that is how they come up with what is the cause. And then I think a lot of questions that people or some of your clients have out there, is this going to happen again? Am I going to have this?
Sure.
And the answer is, if we are truly talking about cannabis-induced psychosis, you probably won't have a problem if you quit.
That's what I always say. I say, if you continue doing this, this is probably going to continue happening and intensify to the point where you may have a nervous breakdown or you might just crack.
And in fact, I'll even say some of the literature, slightly mixed, but even shows, even with somebody who has schizophrenia in the family history,
sure,
this stuff might induce
intensify
the first psychotic break.
Sure.
If you already have psychotic disorder, bipolar schizophrenia, it's going to intensify it or exacerbate it.
Sure. And isn't that usually typical of, well, not always, but you'll start seeing signs of schizophrenia if somebody does have like mental health in their family system around 20 or 21.
Mm-hmm. That's how I always think it, but it could present at 30. And if you really think about it, just like substance abuse, I like people to think about these things like this. In the same way, sure, there's a strong genetic component.
Yes.
And let's say more than likely in the case of schizophrenia, let's say they have a 70% chance of getting it. That's not the number, but I'm saying. But these things that are going to present themselves, they do in time of stressors, right? Let's say you put a guy that's going to have his first psychotic break and he just went from college to a rigorous engineering program at Caltech. That first semester might be his first psychotic break. And that same token, a guy that's smoking this kind of potent pot, and you don't know why he's smoking it because he's been having maybe issues at the age of 13, 14, 15, 16, 17,
right.
And he's self-medicating, right? And for a moment, it does that.
Yeah.
But
see, even as an interventionist, I was just talking to a family earlier today about their daughter being in their mid-30s, has gone into this, and that's not actually from, I have to kind of figure out, like, was there any kind of addiction or anything in their past that's led up to this, or was there any substance abuse or
in the daughter's past or the family?
in the daughter's past? Because I have to paint a picture and see, like, who am I dealing with? Like, what kind of person? Because she's claiming that they're out to get you guys, they're out to get me. And she was in a very, she worked in an environment where there was a lot of stress and long hours. And what it boiled down to was, obviously, they told me, well, she is on Adderall. And the first thing I think is it's probably
Adderall-induced psychosis.
And Adderall-induced psychosis, as potentially she's abusing her Adderall.
She could be.
She could be, right? I don't think it's just from the low dosage that the doctor has given her. There's a reason that she's like not normal. And right now she doesn't even seem like she's normal. So then I like that you differentiate between, like, what could it be when it's amphetamine psychosis as opposed to THC-induced psychosis. This is something that, for me, it's newer to see this happening, but I see it happen, and it's happening a lot. There's a lot of the youth is definitely reaching out to me. Lots of them are asking about THC and should they be, and do you think it's becoming a problem, or it has become a problem, and what do I do? And I find myself at the end of the night, these kids, they find me on TikTok and various outlets, just answering quick questions. Just it's easy to tell a kid, just don't do it, right? But I tell the kid usually what I wouldn't do. Or if when I was your age and I had these curious questions about marijuana, I wished I had somebody I could talk to that had life experience with it for real, as opposed to these kids that I was looking up to go and keep doing it so that they can tell me really what to do. And often you'll see these kids that I don't hear from them for a while, and 3-4 months down the line, they said, thank you for talking to me back then. Or
makes a change.
Thanks for your videos because I've quit.
And you know what? I'm gonna digress for a second, and then I want to get back to dose, which is relevant to what you're talking about. I'm gonna digress from what you said.
Yes,
we just did a live together, and it was on Facebook, YouTube, and all that stuff. And in that discussion, we talked about sort of people's sense of meaninglessness, and it's called anomie. The term became in 20th century usage by a French sociologist, and he called, essentially is not being connected to anybody that causing suicide. That doesn't matter, but we really talked about that sense of loneliness and people needing to find meaning in themselves. I'm going to point to you what you just did, which is a perfect example of that. You have kids reaching out to you, and just by being emotionally, psychologically, and by information supportive of them. It's really being loving, right?
Yeah.
And these aren't 5-year-olds. These are still 15, 16, 17, 18-year-olds. I want you to really go back and think about what was missing in the last 15, 20, 25 years. And here you are putting a hand on the shoulder of a young individual, and it made such a profound change. I really want you to meditate and digest that.
Yeah.
And going back to the earlier question before, where you were talking about, well, what's causing this stuff? Well, here he comes. You put your hand on his shoulder over the internet, and you, not only did you change his life, potentially it's exponential. You know, that butterfly effect they talk about? His wife, his kids, who he acts. So I just want to point that out.
I appreciate it. Yeah, thank you.
Now, going back to, what these kids ask you, if I was going to say anything and you pointed it out very pointedly that, what are you going to say? Don't do it. Okay, that's it. If you want to consider, and this is your choice, the context and situation you're in, if you want to consider a harm reduction approach when it's necessary, I would potentially tell someone, and this is one of the big problems, they don't know what they're taking in dose-wise, and we don't know, right? At the very least, I would tell someone, dude, if you're going to be smoking dope, smoke dope. I think they call it flower nowadays. We used to call it bud, because that cartridge stuff and the pen stuff and so forth, that's potent, and you're increasing the likelihood of severe psychological consequences. So I wouldn't smoke it, but if you really got to do it, why don't you minimize the risk to your mental health and everything else and addiction, and at least decrease the dose? And that would be a harm reduction.
I love
approach.
that.
And you can consider that and use it how you want.
I would actually. Another thing I often tell them too, because I think they're questioning and wondering, if I continue to do this, is it going to affect me long term, or could it turn into other things? Potentially it could turn into other things, and maybe it might not, right? But I often tell them, listen, your brain is still developing.
Good. That's
Your brain is still developing, and if you're only 15 years old, example, you're 15 years old and you're doing this, you may be stunting your emotional, your mental growth. In other words, you will find that when you're in your later years, like in 26, 27, even 30 years old, that your mentality has kind of just been held back.
Stunts, right?
It stunts it.
And I think that's a really important thing to point out.
And usually that was scary them, like they're thinking, oh my God, I don't want to like be held back in life. Like maybe I shouldn't be doing this. You know, so
a little bit of scaring somebody in a good nature is okay, but you're also telling them the truth.
Yeah,
and at those ages, the neuroplasticity is significant. That's what the nerdy neuroscientists call it.
Yeah.
And it's quite significant because it's a developing brain. And I would say everyone uses the number 26.
Yeah.
I would say it's even closer to 30 before you have a fully mature adult brain in the Western world.
That's a big deal to know that. That is a big deal to know that. And a lot of people don't know it.
They don't. We got to close for today. This is a short video. I want to recap on some of the things that we touched real quick for everybody. We wanted to know what cannabis-induced psychosis was. We sort of wanted to digest that and give them something back. And we decided that, psychosis is psychosis, and then there's cannabis-induced psychosis, which is still psychosis. We described what that was. Mm-hmm. We described it's probably caused potentially by the fact that the dope nowadays is much more potent than before, than cannabis. We also described that given the same potency, we're probably seeing more people going into treatment than they ever have for this kind of thing. Mm-hmm. We discussed some of the things that you run into and the kind of feedback you give these kids and how important the psychological wholeness is in the early youth, which is one of our social problems, which we can dig into another point. And we also, what else did we discuss? We talked about a harm reduction approach to intervention, whether it's you doing it or even myself. And when the topic is brought up, especially with the youth, and if you can't get abstinence, if you're going to turn them off from you, if they're going to ignore you, it's possible to educate them and propose to them an option. Don't do the pen, don't do the vape or the other stuff. Smoke it if you have to. I don't advocate it. And this might reduce risk and harm in the long run. Did I miss anything?
No, you didn't.
Anything else?
Everything's covered. I think I'm satisfied. Are you?
Yeah, I think I'm satisfied.
Yeah.
For my audience out there, guys, thank you very much.
Mine too.
Don't forget to both of us like and subscribe our channels. And again, this was a little offshoot thing. We might be doing more of this stuff in live format. But we wanted to kind of test this video out because I love Pedro's input and all of these issues. He has a lot of experience. Pedro, you got anything for your audience?
No, I appreciate that. I'm a fan of Dr. B. I learned so much from him. I watch all of his stuff, and it's nice to come together. And we will be making a lot more videos. You can tune in to either one of our channels because we're going to be interacting a lot.
Likewise. Thank you, guys.
Thank you.
Peace.